Late Night Health continues. In about 10 minutes, Jim Laval will be joining us again. He's the only guy in the last 2 years who's been on the show, actually the last 4 years of the show, who's ever stuck me with a needle. I'll tell you about that.
Oh, I doubt that.
No, he really is. He took a blood test of me about a year ago, I think. Anyway, it was in September. Jim will be joining us in just a little bit here on Late Night Health. Right now, we're go to upstate New York as we speak with Robert Clancy, author of The Hitchhiker's Guide to the Soul. We've got Ramona, and she is a almost 17-year-old from Germany. And we go to Eugenio from Italy, and he's almost 18. Let's talk about going to the doctor. Do either of you like going to the doctor in general?
Oh, definitely not.
No, me either.
But what's it like going in? Eugenio, we'll start with you. In Italy,
okay.
What's the process?
So, for a normal person, can go any moment to the doctor. We have hospitals, and hospitals are free for everybody. But the problem is the hospitals is great for you when you have just, for example, a flu, and it's something easy to diagnose, and they give you just medication and it's fine. But if you have something more serious, it's a problem because in the normal hospitals, the doctors usually they're not great. They're like average. They're not very intelligent, and so.
Doctors in general, maybe.
In general.
So,
yes.
Right. And what about alternative forms of healthcare treatment?
Yeah. If you have something serious, you gotta go for private doctors that they are the best in Italy, and you have to pay. You have to pay money, but they're so much better than hospitals because in hospitals they're free, but they're not that good.
And what about alternative health? In other words, a chiropractor or a nutritionist, an acupuncturist.
Yeah, we have also those type of doctors, and personally, I've never been to one, but my parents did. They work really well for them without use medication, so I think they're great.
Good.
But you have to pay them.
Got it.
They're private.
And Ramona, how about you?
It's kind of the same. But I noticed here when I was in America, I got really sick at the beginning of the year, and I had to go to a doctor. And then months later, I got a big bill of $50, and I was really shocked because I just went there to get checked through, and I got medication and everything. And it's bad if you have to pay to go to the doctor, and we're not used to that. I think it's really nice in our countries that we can just go and they help us, give us medicine, and just special treatments, you have to pay them.
My friend Catherine, whom you may have, I don't know if you've had a chance to talk to her or not, she's a publisher, and she is from Germany, told me that the first line of defense in Germany is alternative treatments rather than allopathic or traditional medicine. Have you experienced that as well?
What means that exactly?
Well, it means that you'd go to a chiropractor before you went to an orthopedic surgeon. You might try acupuncture for pain relief.
Oh, exactly. Yeah. You definitely do that first. Yeah, my mom went through that too, to that process. Yeah.
And it worked for her. She liked it.
She is right. It definitely worked for her. Yeah, she liked it. I definitely get what she means. Definitely.
My understanding is it's also less expensive. I mean, even here in the U.S., it tends to be less expensive than traditional care, but it's used as the first line of defense against, a problem. Your back goes out, you have the flu, and you need to do something.
Mm-hmm.
And so that's how it's used. Eugenio, you are contemplating LASIK surgery, I understand.
Yeah.
And tell me about that.
You can have a laser surgery to the eyes in a normal hospital, but it's high risk to they made a mistake and you get blind. So normally normal people go to a private doctor for don't have risk and like have the laser well done, because for normal stuff it's better go to the hospital, but in like laser stuff and surgery it's better go to a private person.
And when you go to the private person, do you know what that will cost you? Any idea?
Yeah, because there are a lot of different doctors, private doctors, so you will always know how much they will. How
Well,
much it will
here in
cost
the
you,
U.S., here in the U.S., we're always seeing advertisements for this kind of surgery, the LASIK surgery, and it can go from $400 up. Any idea of what it'll cost you in Italy?
yeah, I think kind of the same.
About the
From
same.
400. Yeah, like if you go to an hospital, you can get it free, but from a private doctor, it can cost from $500 to around a couple of thousand.
Wow. Per eye, of course. Hey guys, thank you very much. We'll have before you guys go. When do you guys go back?
In 1 month.
Oh my!
Yeah.
Well, I hope to be able to spend some time with you, at least on the phone. Okay, Robert. Thank you very much.
Well, thank you again.
Thank
very
you,
much.
guys. We will talk. All right. Jim Lavelle comes up next in just a few minutes here on Late Night Health. Don't go away. More coming up.